Hello everyone, my name is Shiny Paul Matthew. I am the Assistant Director of Nursing for Infection Prevention and Control in TUH University Hospital. Today I'll be presenting a case study on the use of BioClenz Plus for drain decontamination. In today's presentation, I'll be giving a brief overview on the background of healthcare-acquired infections in CPE, on BioClenz Plus, environmental sampling prior to the evaluation of BioClenz Plus, methodology, results, conclusion, and discussion. The emergence of different multi-drug resistant organisms such as CPE, VRE, and even Clostridioides difficile has been reported worldwide over the past decade. Biofilms containing these multi-drug resistant organisms tend to contaminate our healthcare environments, mainly the hospital sinks, the drains, and water pipes. Mature biofilms, they release planktonic organisms back into these environments that are capable of contaminating new areas and pose infection risk to patients. More and more research and evidence is required in this area to assist future practitioners to combat this issue. The contribution of biofilms in the colonization or infection of patients is also becoming increasingly recognized. Biofilms are difficult to treat, as you all are aware, and they have certain intrinsic resistance to detergents. They have increased tolerance to disinfectants, antibiotics, and heat. The resistance to biocides is lost, and it's important to note that if the biofilm is dispersed, that this resistance to biocides is being lost. And that's why it's important regarding decontaminating your drains. Biofilms increase the likelihood of genetic exchange between bacteria, and I suppose you have heard that before. They kind of encourage the transfer of genetic material between bacteria, increasing genetic antibiotic resistance. Therefore, it is very important to have strategies to disrupt and remove these drain biofilm and the pathogens within them. Also, prevent the re-establishment of these pathogens is very important, and the biofilm itself. How it has been acknowledged that they are notoriously difficult to eradicate with our traditional methods. And coming to BioClenz Plus, it's a hypochlorous acid solution, and it has been independently tested against the only registered biofilm protocol, the EPA's SOP MB19, growing a biofilm using CDC biofilm reactor and US EPA. This case study demonstrates the effectiveness of BioClenz Plus against biofilm and the bacteria they are harboring in the drains in our hospital. Just a quick note on healthcare-acquired infections in CPE. You're all aware about our recent National Point Prevalence Survey in 2017 of healthcare-acquired infections and antimicrobial use in Ireland. The prevalence, HAI prevalence, was 6.1%, and this was an increase when compared to the 2012 PPS survey from 5.2%. So one of the most concerning HAIs from the PPS was CPE. CPE initially emerged in Ireland in 2009, but there was a rapid increase in the incidence since 2016. CPE was declared as a national public health emergency in October 2017. And this initiated the introduction of monthly CPE surveillance reports, and a lot of resources was put in place to manage CPE in Ireland. In the most recent summary reports on CPE, a 30% of increase in detection in 2022 itself was noted compared to the corresponding period in 2021. Just a note on TUH University Hospital. So we are one of the leading academic teaching hospitals. We cater to the needs of children, adults, and older people. We have a total of 562 beds, 16 theatres, and 21 critical care beds. Over the years, TUH has done a lot of work to control CP outbreaks. There was recent CP outbreaks in 2022, so we had 2 CP outbreaks, and environmental contamination, especially the drains, was noted as a factor in these outbreaks. Prior to the evaluation of BioClenz Plus, or even before we knew that BioClenz Plus existed, we carried out an environmental sampling project here in the hospital in 2022. So environmental sampling was carried out at random in multiple clinical areas with the swabbing technique as per our hospital policy. We were using a combination of steam cleaning followed by a 2000 ppm solution to treat drains and subsequent environmental contamination and biofilm. So 18 swabs from the environmental sampling had returned positive for CPE during this project. We treated the drains weekly with steam cleaning. While there was an immediate effect of this disinfection method, 3 days after the treatment, what we found was the swabs from the environmental sampling in certain areas returned positive for CPE. So steam cleaning was effective, however, it didn't stay long, which warranted a need for twice weekly steam cleaning, and that was very resource intense, and therefore we agreed to evaluate BioClenz Plus as an alternative option, and we started the trial on 8th of January 2023. So BioClenz Plus is registered and authorized in Ireland in accordance with the Biocide Product Regulation. It's supplied in a tablet form. Once diluted with water, it forms a hypochlorous acid solution that has been independently tested against the only registered protocol that demonstrates efficacy against the various bacteria, various multi-drug resistant organisms within biofilms, achieving between a 6 to 8 log reduction. So additional testing was also carried out against DN standards against bacteria, viruses, fungi, mycobacteria, and spores, as you see here. So the methodology that we use for evaluation of BioClenz Plus, the evaluation carried out following a standard operating procedure specifically designed for use in healthcare facilities to assist in controlling pathogens present in shower and sink drain lines. 2 wards were selected for the evaluation, and the evaluation was supported by the scientific and technical terms in Meditech, and full training was provided to the TUH teams, and it's mainly our hygiene services here in using the product. Each drain, 22 in total, was treated with 5,000 ppm of BioClenz Plus, so it's 5 tablets in 1 liter. So it was treated with the BioClenz Plus solution once a day daily for week 1 and 2, and then twice weekly for week 3 and 4. We did environmental sampling as well at the same time, so 3 times for week 1 and then twice weekly for remaining 2 to 4 weeks. Regarding the results of this evaluation, a total of 22 environmental samples were taken in 22 drains at day 0, with 7 swabs returning positive for CPE. That accounts kind of 32% of positivity there, and this was a control for our study. After treatment of BioClenz Plus commenced, a total of 219 environmental samples were taken in the same 22 drains across a 4-week period. All the swabs taken during this time returned negative with a 100% reduction, and that was very promising. To conclude, the on-site results of the evaluation of BioClenz Plus in Tallaght University Hospital demonstrate the effectiveness of the product in managing biofilm and microbes they are harboring in hospital drains. Following the successful results on-site, we developed a business case for hospital-wide use, and that was approved. Additional education and training was provided by Meditech team, and we have now rolled it out hospital-wide for hospital-wide use in shower drains. We are further planning to do further analysis locally to determine the impacts of this intervention on the rates of associated healthcare associated infections. Thank you for listening to this case study here, and I hope you will find it beneficial. There will be a team from the Meditech here to answer any questions related to BioClenz Plus. Again, the treatment in our facility, the treatment that was provided or the protocols provided in our hospital might be different from the ones that will be recommended for other areas. It's all based on your contamination within the drains. So please feel free to contact the Meditech team if you would like further information on BioClenz Plus, and I'm also happy to answer any queries that you have. Please forward it to me, and I'm really sorry that I'm not there today, but thank you all for your time, and hope you all enjoyed today. Thank you.